Hey everyone! Today we are talking about melatonin and heart failure. In November 2025, a study from sunny downstate presented at the American Heart Association scientific sessions alarmed many people. Researchers used the TriNet-X Global Research Network to review 5 years of health records from over 130,000 adults with chronic insomnia. They matched 65,414 melatonin users with 65,414 non-users using more than 40 baseline factors, including other diseases and medications. During follow-up, 4.6% of melatonin users developed heart failure compared to 2.7% of the control group. Hospitalization for heart failure hit 19% of users versus 6.6% of non-users. Death from any cause was 7.8% in users compared to 4.3% in non-users. This study only observed people without assigning treatments. The design means the numbers reflect association and not direct cause. The participants already had severe chronic insomnia, and that condition alone raises heart risk through stress hormones and nervous system strain. Hidden health differences between the two groups explain the gap rather than the supplement itself. Now look at the experiments. In March 2025, researchers at Alborz University of Medical Sciences in Iran published a combined analysis in Clinical Cardiology. They merged 4 randomized controlled trials of patients with moderate heart failure, where symptoms appear during activity but not at rest. The studies lasted 8 to 24 weeks and gave patients 3 to 20 milligrams of melatonin each night before bed. These trials showed that melatonin improved daily life in measurable ways. Patients reported deeper sleep and less daytime tiredness and stronger appetite. For heart failure patients, these changes are powerful because breathless nights and poor rest are core burdens of the disease. Melatonin gave them back energy and comfort in daily living. Supplement also improved how well arteries flex and open. In the ME-HR trial, 10 milligrams nightly for 24 weeks raised artery flexibility from 5.6% to 7.5%. Better artery flexibility means lower blood pressure stress on the heart muscle. When arteries expand properly, the heart pumps more efficiently and uses less oxygen. Melatonin dissolves in fat so it enters cells easily and reaches the mitochondria. Mitochondria are the tiny engines inside cells, and the heart is packed with them because it needs constant fuel. Melatonin neutralizes harmful oxygen molecules directly inside these engines to protect energy output and prevent cell death. It also turns down inflammatory signals that scar heart tissue and harden arteries. Plus, it blocks the pore that triggers cell suicide when oxygen runs low. These combined effects preserve heart muscle and keep blood vessels supple. Animal studies spanning 30 years confirm protection against heart attack damage and chemotherapy-related heart injury. The reason for the paradox is simple. The observational study followed insomnia patients taking various unregulated doses for years. The trials treated diagnosed heart failure patients with exact pharmaceutical-grade doses for weeks to months. Chronic insomnia often comes with other untreated medical problems and extreme stress that damage the heart independently. American supplement shelves contain melatonin with no guaranteed purity or dose accuracy. Some pills contain far more or far less than the label states. Trial participants took melatonin 30 to 60 minutes before bedtime to match natural body rhythms. Taking high doses at random times throws off your internal clock, and that clock disruption itself endangers your cardiovascular system. If you carry a heart failure diagnosis, then controlled short-term melatonin use is supported by trial evidence. It improves sleep comfort and blood vessel function. Use the lowest effective dose for a set time frame rather than buying bottles off the shelf indefinitely. If you are a healthy adult swallowing melatonin every night for chronic insomnia, you should rethink the habit. Unregulated long-term hormone use is a poor substitute for fixing the actual sleep problem. Seek evaluation for issues like sleep apnea or anxiety and adopt proven sleep habits instead. Your heart will benefit more from resolving the root cause than from masking it nightly. The key point is that context changes everything, and observational data from sick insomniacs does not apply to structured treatment in heart failure patients. Supervised pharmaceutical-grade melatonin helps people with existing weak hearts function and rest better. Nightly high-dose supplement use by healthy people with chronic insomnia is a different practice with risks tied to dose inconsistency and hidden disease. Choose your path based on your actual diagnosis and fix chronic sleep trouble at its source rather than relying on a hormone year after year. Thank you for watching, everyone. I will see you next time.